came across a story of a lady who talked about, her brother's story, how her brother was diagnosed with end-stage kidney cancer. So she said her brother was a security man, worked somewhere in the UK as a security man, and was having this cough, cough that he never really paid attention or thought the cough was anything serious. Had cough for a couple of months, and only for him to eventually, go to his doctor and get checked, investigated. And then the brother was called by his doctor, and the bad news was broken that he had kidney cancer, malignancy. And 6 days from that diagnosis, her brother passed. He died. Such a tragic and sad news. I've thought about it. A lot of the time we talk about risk factors for cancer, things that can increase the person's risk of having cancer: cigarette smoking, having an unhealthy diet, having a sedentary lifestyle, not exercising, having a family history of cancer or malignancies. We talk about all of these things. Some we could change, some we could not do anything, some we cannot do anything about. If you have a family history of cancer, you cannot do anything about it. You can't change the fact that a family member of yours has been diagnosed with cancer in the past. But I've thought about it, I've reflected upon it, and I've said, you know what? Who would have a cancer and who wouldn't have a cancer is purely down to chance. It's purely down to luck. It's hit and miss. It's a random selection. It can happen to anyone. You could have the most healthy lifestyle. You might not have any family history of cancer. You might now have cancer. You will now become the positive family history for someone else in your family. May that never be our portion. That's what we don't pray for that. But in reality, cancer can happen to anyone. As long as you are alive, being alive is the number one risk factor for any malignancy, any cancer. The fact you're alive, you've got active cells all over your body, your eyes, your brain, your lungs, your skin, your kidneys, your adrenals. Think about, you have cells everywhere. All it takes is for one cell to run amok and things begin to happen. May that not be our portion. But the thing is, it can happen to anyone. We'll continue to encourage healthy lifestyles. Do not smoke, exercise, cut down on your weight, eat healthily. At the end of the day, it's all down to, luck, random selection, really. Stay safe, stay blessed, stay healthy, look after yourself.